don't we talk about acne?
Sure.
Do you see a lot of that?
Yeah, I do. Actually, I have quite a number of patients. I'm qualified in facial rejuvenation acupuncture, which can actually be very helpful for acne as well. But again, I like to find the root cause. So is there a lot of stressors going on? Is there food intolerance? Is there a hormonal imbalance, which I find often to be the case, for sure. Yeah.
Okay, so that's interesting to me. So if people have acne, is there something they can do on their own to try to fix that? I'm sure they've probably tried. By the time they're coming to see you, they've tried.
Absolutely.
So eating a healthier diet could be a big one.
Yep, absolutely. A low inflammation diet, so a lot of whole foods, lots of fruits and vegetables. That's sort of the cure for everything. But sometimes it's something that can be healthy, like tomatoes can cause inflammation for some people. For other people, it's very, very healthy and great for the skin. So what often I'll do is like an elimination diet. So we take everything out and then we try things back in, and we'll see if something specifically is irritating that patient. Yeah.
In other words, if you find a hormonal imbalance, then you work with
that specifically.
And that's when we get to herbs and supplements and other...
Herbs, supplements, acupuncture, all that kind of stuff, yeah.
I think acne can take a longer time sometimes to remedy.
Absolutely, yeah.
Yeah, but you often have success doing so?
Yeah, I find in general, if people stick with the protocol, and it is, sometimes we ask a lot of people, changing their diet and changing lifestyle can be challenging for sure. And I was just saying to someone today, I find when people, stick with it, which is challenge, they almost always have success. It's just that coming back often and staying with the diet protocol and staying with the herbs and the other things we prescribe. And the other homeopathy sometimes can be helpful.
Is there anything else to talk about with regards to acne?
I find that one is probably one of the more challenging ones for patients. I find it can really affect everything in their life. And, I think that it can really increase rates of depression and anxiety as well. So when I'm working with patients who have acne, I also like to work on that aspect, self-esteem, and I think that that's massive. I had a patient the other day say to me, no one has ever asked me how my acne has affected me emotionally. And it was an excellent release for her, and I think that's what she needed, and I think that can actually even help the skin condition because you feel less stress and less built up emotion all the time. Yeah.
I had acne for many years in high school and in my early 20s, and it just had a tremendous impact on my life.
Yeah.
And consequently, it took me much longer to build more confidence in myself when I finally got rid of the acne. And it would have been amazing in my teens if I had just gone to see a naturopathic doctor and got it figured out.
Yeah, right? I love it when I see people who are 16 or 17, and it's right at that age when everyone is struggling with self-esteem. And I always include that as part of the protocol. We do guided meditation, and we just talk about it, and sometimes acupuncture can really help with that as well while we're working on the acne.
Yeah. Nice.